All right, thank you, Dr. Johnson. So today I have the pleasure of introducing Dr. Andrea Duncan. Dr. Duncan has received her medical degree and completed her pediatric residency as well as neonatal perinatal medicine fellowship at the University of Texas Southwestern Medical Center in Dallas. She was a clinical scientist, faculty member, and mentor at the University of Philadelphia. She is now the medical director of their neonatal follow-up program and the PI for the neurodevelopmental follow-up of the CHOP site for the NICHD Neonatal Research Network, as well as their site for the Cerebral Palsy Foundation's Early Detection of Cerebral Palsy Network. And her current research involves evaluation of executive functioning and brain connectivity in high-risk infants. Today, she will be speaking on school readiness in children with disabilities. Dr. Duncan, welcome, and the floor is yours.
Thank you. Share my slides. Can you all see that okay?
Yes, we can.
Okay. So just to start with childhood learning and early childhood learning, it's important to remember that education is a process and a product. The process occurs at home, in school, and in the community. And education improves public health and has been shown to promote health equity. And the product of academic success is linked with improved social, economic, and health outcomes. We know from knowledge of early childhood development and early brain development that there are modifiable factors in a child's early experience that impact their learning trajectories. Many children in the US unfortunately start kindergarten with social, emotional, cognitive, and physical developmental deficits that may have been addressed with early identification and intervention. And this issue is really exacerbated in children with special needs that we take care of. So school readiness, what is it? It's really a framework for assessing the strengths and vulnerabilities of kids at preschool age in the context of an upcoming school transition. School readiness, where the child is concerned, is indicated by competence in each of 5 domains, including health and physical development, approaches to learning, cognitive skills and general knowledge, social emotional development, and language skills. The most widely accepted model of school readiness is one of an interactional relational model. And what that means is that school readiness is an ongoing interaction between the child and the environment. It's a product of a set of educational decisions that are shaped by the skills, experience, and learning opportunities that the child has had, and the perspectives and goals of the community, classroom, and teacher. So this is something that is ongoing, is an important word in this definition. It is shaped by the environment as well as the child. So there's 3 overarching facets that go into school readiness. So the schools need to be ready for the children. There needs to be a capacity of families and communities to provide the developmental opportunities that their young children need in order to learn. And the children need to be ready to transition into school. So this figure really puts together all of the facets that come together to help a child be ready for school. You can see the 5 domains, the 5 child domains that I mentioned: the physical development, social emotional development, approaches to learning, cognition, and language. Those are the child domains, what the child needs to have accomplished in order to be ready to go to school. And you can really see that those domains are contained within and supported by environmental facets, including the educators, families, readiness, the schools, the communities, and the systems in place. So it's not just about the child. So in terms of the school's readiness for children, what does that look like? A school that is ready to educate a child has strong leadership. A ready school offers opportunities for regular parent engagement, understands early childhood development, and that children learn through play and natural experiences, and provides high quality instruction at a rate that challenges but doesn't overwhelm children. These schools also have a commitment to success of individual children. And so some of the things that are really necessary in order to be able to provide those individualized care in order to educate all of the children are understanding the effects of adverse childhood experiences, things like poverty, racial discrimination, trying to meet special needs within the regular classroom, having an inclusive environment. Implementation of individualized education programs that include adaptations for children with disabilities. And the safe, secure, and inclusive environment that supports student health and wellness and promotes learning. In addition, there has to be a commitment to the success of every teacher. So just like the support, there needs to be individualized support for the children, there needs to be individualized support for the teachers. Inclusion of approaches to increase achievement, like parent involvement, early interventions, and alteration of practices and programs if they don't benefit children, and a willingness to take responsibility for the results. So that's a readiness. That's how to know if a school is ready. What about the family and community capacities? What does a ready family and community need? Excellent health care. So prenatal and ongoing primary care. That is critical to having a healthy community who is ready to support children to meet academic needs and to succeed there. Optimal nutrition and daily physical activity. Access to high quality preschool, childcare, and opportunities for daily parental input to foster their child's learning, and supports that allow parents to be effective teachers and teach them to do the same, because parents are a child's first teacher. And what about the children's readiness? What do the children need to be ready for school? Well, as I said, there's 5 domains in which children need to be ready in order to go to school. So physical well-being and health, appropriate social emotional development, approaches to learning, language, and general knowledge and cognition. And just to give you a little bit more detail about that, physical well-being includes, general health, growth is important, and sensory motor development. Visual spatial skills are very important. If you consider the amount of fine motor activities that are included in kindergarten, it's really easy to see how important it is for children to have not only the stamina to be able to participate, but also the motor skills to be able to participate. Social emotional development. This includes self-regulation, attention, ability to control impulses, and limit aggressive or disruptive behaviors. Children have to be able to cooperate and communicate their own emotions and feelings. And when we talk about approaches to learning, that includes enthusiasm, curiosity, the temperament of the child, and also values that the child has learned to really understand the benefit and importance of education. And language development, and that doesn't just include the ability, expressive language, that includes listening, following instructions, expressive language vocabulary, and literacy skills. So early literacy skills like print awareness, story sense, writing, and drawing processes. And then general knowledge and cognition, which involves math skills and also those early literacy skills. So there are a number of misconceptions around what school readiness is. And some of those are that learning happens only in school. If you think about the model that I showed, children are interacting with their environment in multiple different contexts, and they're learning in all of those contexts. Readiness is a specific condition within each child. That is just not the case. Readiness is really taught, not waited for, and that's complex. It's not something that can be measured easily. And there's also a misconception that readiness is mostly a function of time, maturation, and some children just need more. And if you consider the fact that there's this ongoing interaction that's necessary, and experiences of learning academic readiness, then waiting without experiencing those interactions is not going to get a child to where they need to be. It's also the misconception that children are ready to learn when they can sit quietly at a desk and listen. And there's kind of been this academic trickle down that I know it can be frustrating to some teachers and parents as well, in terms of the idea that children as young as kindergarten and even preschool need to be able to, it's natural for them to be able to sit quietly and listen. And that children who are not ready do not belong in school, which is not always the case. There are a number of influences as well to school readiness. Early brain pathology. A lot of our children with special needs are born at high risk, maybe dealing with early brain pathology or developmental impairments. There's also, as I said, environmental experiences that influence a child's readiness, adverse childhood experiences, poverty, displacement, maternal depression, and prenatal exposures can also influence school readiness. The National Association for the Education of Young Children put out a statement in 1995 outlining three large influences to school readiness in children. One, the diversity of the children's early experiences, variation in young children's development and learning, and whether or not school expectations of children at kindergarten entry are reasonable, appropriate, and supportive of individual differences. So in terms of children with special needs, so we've talked a lot about individual needs, individualization, and the complexities of school readiness, and that can be even more so for children with special needs. And in terms of the history of education and readiness for children who have disabilities, prior to the Education for All Handicapped Children Act in 1975, many kiddos who were categorized as permanently not ready for school if they were disabled or had special needs. For those with a significant impairment with presumed normal intelligence, which often equated with vision or hearing impairments, then adapted learning environments were sometimes made available, but others were labeled as ineducable, and many ended up in long-term care or being trained for a very specific activity. And then with legislation and court decisions, a concept was developed of a fundamental right to a publicly supported education for all children, regardless of their special needs. And then in 1986, the amendments to the Education for All Handicapped Children extended that right for fundamental publicly supported education to children beginning as early as 3 years of age. And then in 2004, the Individuals with Disabilities Education Act came to be, which ensured that children with special needs had access to a free and appropriate education in the least restrictive environment with adequate supports and services. And Part B of the IDEA covers children with developmental disabilities from 3 to 21 years of age, and then Part C covers children from birth to 3 years who have qualifying conditions, many of whom we see in our clinics. So again, when it's important to think about this model with children with special needs in mind. Academic and school readiness is a very complex idea. And if you consider the intersections and increased needs that children with disabilities have, it becomes even more complex. So I'll go through just a little bit of research surrounding a couple of common disabilities that we see. So in terms of premature children, we know that they're at higher risk for school readiness difficulties than their peers who are born at term. A third to a half of very preterm children born below 32 weeks have deficits in more than one of those 5 domains of school readiness. Very preterm children perform at a half to 1 standard deviation below their term-born peers at school entry across all domains overall. And there has been a relationship demonstrated between neurodevelopmental deficits at age 2 and school readiness at 5. But it's important to remember also that as we see, many kiddos who are born preterm do perform within age expected ranges on the developmental assessments that we perform. And within the category of preterm, there are other risks that may need to be identified in order to further delineate who might be at higher risk for decreased school readiness. In particular, there have been studies of kids who are less than 30 weeks who were found to be at risk of developmental coordination disorder. So in that lower level of lower percentile level on the movement ABC at age 5. And so kids who fell into that at risk for DCD category had poorer performance in the health and physical development domain, the social emotional development domain, their cognitive skills, and their language skills. In addition, 5-year-old children who were born preterm with minor neurological dysfunctions that did not fall into the range of cerebral palsy also had poorer school readiness. So it may be necessary for us to also pay close attention to groups within that overarching umbrella of prematurity to determine risk. And then there's the preterm phenotype. So I'm sure most of you are aware of this, the fact that children who are born preterm, especially at the earliest ages, even those who perform in the normal range on early developmental assessments or have no discernible brain abnormalities on standard neuroimaging at early term age, over 50% of them have deficits that come together to form this preterm phenotype. So what does that look like? It looks like deficits in language comprehension and expression, social communication, learning difficulties, problems with impulse control, organizational abilities. So these more executive function type skills, social immaturity, emotional ability, problems with anxiety and internalizing conditions, and this disorganized and immature motor coordination, which may fall into that developmental coordination disorder category. So that's the preterm phenotype. And if you think about this preterm phenotype in the context of this model of school readiness, it becomes immediately obvious just how at risk for academic problems our preterm children can be if you consider just the domains that are covered in the are impacted by the preterm phenotype. You may have children going to school who have not previously had abnormalities on assessment, who are yet going to school behind in 4 of the 5 domains of academic readiness. Similarly, children with cerebral palsy, up to 55% of them may have delayed communication skills at kindergarten entry. A half of 5-year-old children in one particular study, 5-year-old kiddos with CP, had 1 or more activity limitations in oromotor function or communication, and 16% were nonverbal. And those with severe motor deficits are more likely to have significant deficits in their school-ready domains outside of language and communication. Overall, children with CP tend to perform below the mean for compared to typically developing peers in the domains of physical health, social emotional functioning, and communication domains. Self-care scores have been demonstrated in research to fall between 1/2 to greater than 4 standard deviations below typically developing peers, with motor performance scores 2 to 4 standard deviations below, and social functioning scores 1/2 to greater than 4 standard deviations below. Often when we read studies about children with cerebral palsy, physical disability is often the most prioritized activity limitation, and with a lot of focus placed on the ability to walk. And And there's good reasoning for that. And part of it is that this is often something that parents tend to focus on. Will my child walk? And so it makes sense that the research would necessarily focus on the ability to ambulate. However, it's important to remember that 80% of ambulatory children without gait aids have been demonstrated to be more than a standard deviation below their typically developing peers in mobility tasks, and also have deficits in communication and social function, so still at risk for school readiness deficits. And the other thing, you know, though there is often a lot of focus on the ability to walk, it's important to remember that cerebral palsy is not just a motor disorder. There are a lot of other morbidities associated with it, including chronic pain, epilepsy, intellectual disability, and musculoskeletal problems that may result from abnormal movement, resulting in abnormal formation of things like joints, behavioral disorders, and almost a third, blindness, inability to feed orally, deafness, and sleep problems. And so again, if you consider this within the context of the model of school readiness, then we really need to be thinking about more than just the walking or the movement patterns in kiddos with CP in order to be able to really make sure that they're ready for school. So moving on to assessments. Often, as we know, starting school can be a catalyst for identification of developmental deficits, but we know that the onset of problems is often much earlier. That can be a little bit more difficult to discover when things are a little bit more subtle, but early identification of children who are at risk of poor school readiness is crucial for providing timely implementation of programs that address developmental needs. And school readiness testing, when used appropriately, can yield helpful information regarding the progress of communities and states in meeting the needs of very young children. But it is complicated. So in terms of appropriate use of school readiness, I just remind you that there is this interactional relational model of school readiness, and it is an ongoing interaction, as I noted before, between the child and the environment. So ready assessment really should be done over time and in context rather than by means of a one-time assessment in the ideal world. Some issues with school readiness assessment is very variable across states in terms of, you know, some states require school readiness testing, many don't. It can be helpful if used to directly support children's developmental and academic achievement, though. School readiness assessment should not be used to exclude, in isolation, should not be used to exclude age-eligible children from kindergarten. It should use multiple tools for multiple purposes, address multiple developmental domains and diverse cultural contexts, align with early learning guidelines, collect information from multiple sources, implement a systems-based approach, and avoid inappropriate use of the assessment, like labeling, restricting kindergarten entry, or trying to predict future academic success based on the assessment alone. In terms of children with special needs, all of that applies. I reiterate that we really should try to evaluate all the domains of school readiness. Most studies of children who were born high risk or have special needs don't evaluate all those domains. And also there need to be the consideration of adaptations for those children. When I was looking through some of the literature regarding children with special needs, I just made this table because I wanted to just keep track of what types of assessments folks were using to assess kiddos with special needs for across the domains for school readiness. And in terms of physical well-being, I saw the GMFCS use, the Pediatric Evaluation of Disabilities Inventory, the CSBS Developmental Profile, the Movement Assessment Battery for Children, and the Developmental Test of Visual Motor Integration. You'll notice some of those are questionnaires and some are direct assessments. But I just wanted to note that the GMFCS is used in isolation in a couple of studies because the ability to ambulate is often used as a pretty good proxy for physical well-being. Social emotional development, again, people were using questionnaires in the literature that I found, though there's not a lot. Approaches to learning, the the brief rating of inventory of executive function, the preschool version, that is a questionnaire, and then the working memory test battery for children. The digit recall and non-word list recall, which was a direct assessment, were also used. Same for language development. Some were using questionnaires, others were using direct assessments, and similarly with general knowledge and cognition. And the researchers did choose different domains or different subtests within these scales to look at different domains. And I point this out just to say that you don't necessarily have to have the expertise or personnel to perform direct assessments in order to have some assessment of school functioning, of academic readiness. So issues. There's a number of issues related to school readiness. There's the instability of early categorizations, which is why it's so important not to forever label a child. Consequences of school isolation, if that happens. The role of teacher variability. Remember that it's an interaction between the teacher, environment, and child. The influence of ethnic and socioeconomic factors. In 2004, the National Association of School Psychologists had a position statement that said, and their take was that placing the expectations of school readiness on families and schools is more constructive than placing the burden on children to meet the expectations of schools. So moving on to interventions, if you consider the model, it becomes pretty obvious that interventions should necessarily happen within different contexts as children are learning in every environment that they are in. So just as each of a child's early experiences of their world, whether at home, in childcare, in other preschool settings, may serve to prevent optimal learning, so may they help ensure it. And that's my belief. And often in clinic, I remind parents that they're their child's first teacher, and it really empowers them. So I'm just going to summarize some of the evidence-based interventions that have happened and been shown to be beneficial. So early intervention programs for formerly preterm children or children at risk, NICU graduates, they do decrease developmental delay. And again, remember that this is a very heterogeneous group, but all comers have been shown to improve developmental delay, decrease grade retention, accelerate placement into special education for children who need that. But I mean, this is my addition, it does need to be multimodal. And again, we need to remember the multiple domains that we need to be thinking about in order to make sure children are prepared. Food supplement programs like WIC and school nutrition programs have been shown to reduce the rates of low birth weight and iron deficiency, which is associated with developmental delay. And children attending schools with school nutrition programs have improved scores on standardized academic tests. Home visiting programs by nurses have been demonstrated to reduce the rates of childhood injury, increase the involvement of fathers, reduce family welfare dependency, and improve school readiness. Housing subsidies, improved neighborhood safety, smoking cessation programs, and physical activity. Physical activity was mentioned once before. Having access to daily physical activity really helps with learning fundamental motor skills. And remember, that's important for participation and interaction in an academic way. So it helps with learning fundamental motor skills like running, jumping, and catching, which facilitates participation and may contribute to development in other areas like social skills. The intervention that has been most widely studied and most widely touted is preschool. So for children who are not born at risk and for children with special needs. Early childhood education programs, so that's Head Start, that's public school-based pre-K, can lessen the disparity in school readiness that can be created by things like poverty and other toxic stressors. And children who attend preschool programs are more prepared for school, less likely to be identified as having special needs or to be held back than children who did not. And there have been studies that have demonstrated a persistent impact on achievement well beyond kindergarten school entry. And there have been some economic studies demonstrating that long-term social returns on investment in preschools, at pre-K Head Start programs can be as high as $17 for every $1 spent. All of the above is true for children with special needs as well, and inclusive preschool has been shown to improve development of children with disabilities through child-focused learning, play, participation, peer interaction, and development of friendships. And Head Start and pre-K have resulted in improvement across all domains in some studies of children with special needs. And the medical provider. So I mentioned this because the medical provider and those of us working with children in clinic, and this does not necessarily just refer to physicians, but the medical provider is in a unique position to promote use of community supports like home visiting programs that might be available, early care and education programs, and early intervention, and also has the opportunity to work directly with parents to enhance their interactions, like education around reading, talking, play, and also to recognize the need to and refer to secondary or tertiary programs for children and parents with difficulties, like recognition of maternal or caregiver depression, developmental delays, or behavioral health concerns in the child or the parent. And there are also interventions that happen within primary care in particular that have been demonstrated to help, like Reach Out and Read and the Healthy Steps program. So I do look at interactions with the medical provider and the medical team as an area of intervention. The other thing that the medical provider and those of us in this field, the other opportunity that we have is the opportunity to influence policy. So why is that necessary? Really, continuity across early care, intervention, and education programs in elementary school really is essential in order to have the maximum benefit to children and to really improve school readiness across the board, particularly for children with disabilities and who are at high risk. But it's difficult because there's such variability in between states, between counties. And if you look at the early childhood education sector and the K through 12 education sector, there are different funding sources, accountability systems, staffing requirements for each system. Like if you look at this table for early childhood education, if you look at, for instance, who are the agencies, the local and state agencies involved, it may be private, they may be county agencies or family services. When you move to K through 12 education, you go to the public school district Department of Education, and the federal agencies are different. Financing is different. The accountability in early childhood education is very different, as are staffing requirements. So that can really put barriers between having the necessary continuity across those systems, and that's where policy comes into play. And in addition, there's often a lack of identification and tracking of indicators of school and community preparedness. So a lot of the studies that I saw looked at child readiness. I didn't see a lot of, when that's only one little piece, the community and school need to be prepared to, or need to be ready for the children as well. And I didn't see as much research or tracking in that. So there's a number of opportunities. While this is a very complicated area, we have the opportunity to advocate to local and state leadership for enactment of early education policies that support our local communities, educators, and service providers. And to really, that table really showed the fragmentation of programs. So to support and advocate for movement away from fragmented and underfunded programs to more systems level and comprehensive change, that with coordinated accountability, staffing, funding, et cetera, and to really support early childhood education, family support services, medical care, and mental health care, all of which are necessary for appropriate school readiness in kids with disabilities. And the other piece is research. We have the opportunity and uniquely poised to move the research field in this area forward in order to make a difference. So in summary, knowledge of early brain and child development really shows that modifiable factors in a child's early experience can impact their learning trajectory. And school readiness includes the readiness of the child, the school, the family, and the community to support optimal early child development. And school readiness is an ongoing interaction between the child and the environment. It's not just a snapshot at preschool, at kindergarten entry. And most studies in children with special needs, most studies of school readiness don't assess all the domains of readiness. Numerous evidence-based interventions are available to improve school readiness, and variability in intervention delivery does remain a barrier for all children, regardless of disability status. So in conclusion, readiness to learn really does need to be considered long before children reach school age. Otherwise, children with special needs will fall further behind their typically developing peers. And we need appropriate multi-domain assessment and intervention in the preschool period in order to support that transition into school for children with disabilities. And we need increased research to understand preschool, school, family and community status and roles in school readiness of children with disabilities. It really is the responsibility of schools and communities to meet the needs of children at all levels of readiness, and we, in our work, are in a unique position to advance policy, research, and our clinical practices in order to advance school readiness of children with special needs. Thank you.
All right, great. Well, thank you so much. That was wonderful an overview of all the information on school readiness. So we have a few minutes to answer a few questions that have come up in the chat. Let's see, Dr. Johnson had asked, how does new teacher training other than special educational specialists need to be modified to better support and educate students with special needs?
So really it needs to be, there has to be knowledge of early childhood development and the fact that it's interactive and that it's dynamic. And I think that deeper knowledge in that area and ways to respond to individual differences, I think is necessary to help teachers to have the tools that they need to really respond to individual children. I think one of the other issues that teachers often face is the fact that there are burdens within particularly public schools, I guess all schools, but there is the burden of the standardized testing. And so I think that there are often limitations in what teachers can do because there is such a focus on standardized testing for funding, et cetera. And so I think that in order to help them, we need to take a bigger view, a more contextual, individualized view, not only of the children, but of the teacher, and focus it more, especially in kindergarten, on early childhood development rather than academization of kindergarten classrooms.
Okay, and then she had also asked, I think, about the optimal assessment tools to evaluate school readiness. I know you had the table that kind of reviewed some of those. Any additional comments on like optimal timing for those assessments?
So again, it really needs to start early. And it's, I think about this in terms of what we tend to focus on, what I tend to focus on in the follow-up clinic. And, we focus on kind of those domains that we're testing, like language and cognition. And I think that there's more, Reach Out and Read helps us a lot with that early literacy. And I think that really it's not so much about the optimal timing of the assessments as making sure that we're focusing on all of the domains of academic early school readiness very early. and starting to talk to parents about things like self-regulation and supporting them in that, starting to talk to them about the importance of education really, really early and why reading is great and what early literacy is and things like that. So I think it's important. I think that the assessments are useful, especially for opening doors for interventions, but I think that more importantly, where school readiness is concerned, I think that we really need to be thinking about all of those domains and not only the child domains, but the family domains. Because even things like helping parents to understand, again, that you're their very first teacher and every day, it's best if you can read with them every day or have something that's teaching every day, I think is the most helpful.
Yeah, I agree. And I love that you say that they are their first teacher. So I think sometimes they don't realize the impact that they have on them. So let's see. And then Dr. Gong had said that parents of premature children have received a lot of bad news and frequently are happy when their child can walk and talk. When is the best time to approach parents about preparation for school in all the domains necessary? Do you have a specific protocol or kind of, just maybe a gauge on when those conversations start, like in your clinic? Are they less than a year? Are they at a year or older?
Less than a year, really, and I try to do it just pretty organically. am always talking about teaching because it comes up quite a bit, even in their first visit when you're talking about reading. Maybe parents don't recognize that it is good for babies to start reading really early in infancy, and you can talk about why, that this is how literacy develops, and this is the beginning of those early reading skills. And I also find that it is another place where teaching seems to come in, and where I use that language around teaching them as teachers is around sleep, where parents may not feel comfortable. They may be nervous about things like sleep training or helping their baby to learn to fall asleep, and language such as they don't know, and this is an opportunity for you to teach them. You're their first teacher. They just need to learn that nighttime is for sleeping and not for playing. And so couching all of those things that we talk about anyway in terms of teaching, I find to be helpful. Same thing around as they get older, because there's opportunities at every visit. Same thing as they get older with things like tantrums. They simply don't understand about the boundaries, and this is an opportunity for you to teach them that I get my mommy and daddy's attention by being calm rather than by screaming, and they will learn it. And that those kind of conversations not only couches the parent in the teacher role on the side of the child, but also couches the child as a little wonderful being who is primed to learn. And so I think that those are things that can start right away, and things like self-regulation and talking about that. And I also start pretty early. So I don't have a protocol about it. I just kind of keep it in mind and try to couch it organically within the conversations that we're having.
Okay. Yeah, it sounds like it's never too early.
It's never too early.
There's so many areas that you can start with. Okay, and then there's a question, I think, from Dr. Hine. Can you comment on the preparation of non-English speaking children for school?
So I think that it's a really good question, and it's really important because, and when you think about, I'm thinking a lot of things, but when you think about some of the assessments that we use and the fact that they may not be validated in other ages, that sort of goes into this concern about experience and what does the score really mean. So I think that it's again important to things like Head Start are, I think, even more important, especially if you have children who are non-English speaking and possibly more marginalized, depending on their psychosocial risk. I think that services such as Head Start and public school-based pre-K are even more important for those children. But other than that, I think that, helping the parents in terms of couching them as teachers and making sure that that we're supporting them in bolstering their children across domains is just as important.
And then let's see, there's a question of, is there any research focusing on the direct involvement of parents and schools for positive outcomes with special needs children in school readiness, specifically partnering teacher and school, et cetera, prior to the child entering the classroom?
So that's a really interesting question. So I didn't see, I won't say that there isn't any, but I didn't see any about partnering parents and teachers specifically with children with special needs. However, I saw multiple studies demonstrating that regular parent involvement early in school, like at kindergarten age, there was an improvement in academic outcomes, and that's one of the reasons why really a school that's ready for a child needs to be ready for the parents and to have them interact, as it's home where children are going to spend the majority of their time, all hours taken. So but I haven't seen, it would be interesting, especially the part about prior to school starting, I think could be a really interesting research study and an important question to answer.
Mm-hmm. With the updated CDC milestone guidelines, what is its implication to early intervention and school readiness?
I am not sure that it should impact them very much, really, because the domains in terms of where children need to move, where they need to develop skills, doesn't change. And I am a firm believer in tailoring those conversations to the context of the child, meeting the child where they are and making sure that you can help the parents to discover ways to enrich the environment at home and introduce those domains of school readiness early on, regardless of where they start.
Mm-hmm. And then what about student to student interaction? So how can schools or parents get a child ready for interaction with other students?
It's a really good question. And it's, it's interesting because a lot of the papers that I read talked about, particularly about preschool and how important it is for, developing friendships and developing peer-to-peer interactions. But it is true that there can very well be an imaginary barrier, and sometimes it's developmental early on, but then it also can be related to having a child with special needs. And I'm not entirely sure. Part of me wants to say, one of the things that I have recommended in the past is that families start with their family friends and their children, or their family, and their children, people who are closer and safer, and begin there. And then their child should have some more positive interactions and have even more invested adults to support the positivity of those interactions. And then my hope is always that will inform the child's self-worth and their interactions once they go to school. But I can't say that I know that that's the case, but that's what I've recommended. I think it's something that we need to look at more, because you're right, it's not just about putting the child in the class with the other students. That's part of it, but there do need to be meaningful interactions in order for children to develop a positive self-worth and to be able to participate, really.
Mm-hmm. Yeah, and I think that's getting kind of harder too in our times of COVID.
Yeah.
As well. So I wanted to get to this question. I know we're kind of out of time, but do you have any solutions to convince parents who are worried about their children attending school because of COVID, especially in this special needs group where it's so important?
Mm-hmm. I've just really tried to help families work through their own kind of risk benefit analysis. So we've had similar issues with early intervention, was not going into the houses for quite a while and was doing Zoom only, which was fine at first because it was better than nothing, and then it's gotten old. And I found that most families want early intervention to come back into their house, but that's within an environment that they can control, and school is a little bit different. So mostly it's just been a conversation about, I'm trying to understand what exactly are your fears and what do you think the benefits would be. So, and then just talking about what I see as some of the benefits, and then letting them make the decision. But it is hard because I would hate to push and then have something happen. But then on the other hand, I do know that parents are tired as well. And so there's a respite piece of having children go back to school, but it's really been a conversation, and it depends on the family.
All right, well, thank you so much.
Thank you.